My name is Deborah Dixon, and I am the host of Our Voices, the positive aspects in the African American community and the general community at large of Solano County, Vallejo, and all the surrounding areas. I have as my guests today two wonderful young ladies from the Vallejo Unified School District. One is Mrs. Alana Shackelford. Did I say that correctly? And the other is Mrs. Cathy Hahn. Correct. Okay, wonderful. And we're going to be talking today about some services that are available to the community that I'm sure a lot of you don't know about. So we're going to start off first with introducing. I want you to talk a little bit about yourself. You're a school district employee. How long have you been with the school district?
Well, thank you, Deborah, for having us on the show on today.
We're
very excited for this opportunity. As mentioned, my name is Alana Shackelford, and I am the Director of Partnerships and Community Engagement for Vallejo City Unified School District.
What a mouthful. And your title?
Good afternoon, and I'm Cathy Hahn, and I'm Coordinator of Full Service Community Schools, and under that umbrella also includes Student Health Services.
Wonderful. Oh, that's great. Wonderful. You both from Vallejo or just been working for the district for a while?
Mm-hmm.
Born and raised in Vallejo.
Born and raised in Vallejo. Wonderful. And how about you? Are you local?
And I live in Fairfield, but actually been working for the district for 13 years.
Oh, wonderful. Yeah. Oh, great. Okay, well, I've come through the Vallejo Unified School District. I don't think they did such a bad job. My children have, and my grandchildren have. I have graduated grandchildren from Vallejo Unified School District.
That's great.
I like to tell that story a lot because it talks about the continuity of this community and the wonderful things that do happen here in this community.
Right.
So we're going to center today on my favorite subject, which is health. I don't know, I started about 4.5 years ago working out. I walked into the gym weighing close to 300 pounds with a number of different obesity-related diseases, as you can well be aware of. And through the help of nutrition and exercise, I've whittled that down. I lost about almost 78 pounds. Wow. And so I'm totally into health. I've totally changed my lifestyle. I'm totally into going to the gym every day. I used to think people were nuts being gym rats, but now I'm one of them, okay? A lady said to me yesterday, she saw my bag with all the different things, and she said, my God, how long do you stay here? I said, I usually get here about 7 in the morning, and I'm there until about 12:30, 1 o'clock in the afternoon.
Oh, that's awesome.
Oh, yeah, I absolutely love it. So let's talk about the school district and their plans that they have. What is a full-service community school?
I'm glad you asked, Deborah. What full-service community schools are, our goal for the district is to not only focus on creating a rigorous learning environment,
yes,
but also to be in tune with students' social, emotional, physical health needs.
That's very important.
And so being able to educate the whole child, in addition to his or her family, is very important to the district. And we have taken a leadership role in making that our responsibility. At the end of the day, we're expecting all of our students to be able to graduate college and career ready, then it is vital for us as an organization to not only focus in on those academic areas, but also those other areas that affect a student's progress in school.
Absolutely. I'm so happy to hear that, because that to me has been the missing pieces.
Right.
It's lovely to be able to say what it used to be,
Right.
but we live in a world today that rapidly changes by the second. I won't even say by the minute, but by the second. And so we as a school district and we as parents and community, we have to learn to be more responsive to what's going on in our young people's lives. Tell me about that.
When you mention being responsive, that's what the idea of full-service community schools is to respond to the needs of not only our students, but their families. So what we have done, presently we have 3 health clinics within our school district.
Oh.
One located at Elsa Wiedemann Elementary,
Okay.
one at Pennycook Elementary, and the other located here at the Jesse Bethel High School, and it is a teen clinic.
Wow.
We also have a dental clinic located at Elsa Weedham Elementary School. And again, we house these clinics on our school sites because we don't want our families to have to go anywhere. We don't want to have to refer you out.
Yes.
We want to be able to say, you know what, if you go down to room 3, room 2, or just across the street to this particular school site, you can receive medical health services as well as dental.
And the first question that a parent is going to ask you is, how much is that going to cost me?
And that's the beauty, is our services are free. And
free 99? Oh my
$3.99.
gracious.
Yes. Yes.
Talk about that. Talk about what kinds of services that the families may be able to avail themselves with.
So we see children ages 1 through 18. So siblings can come, any member of the family.
Even if they don't go to Elsa Weedham
Right.
School?
And actually, these health clinics are open for all children in Vallejo.
Oh.
So they don't have to go to that school. It's all children in Vallejo,
Oh, that's
ages 1 through
fantastic.
18. And we know that there are some things that keep our children out of school. If they have an earache or they can't see very well, they're not going to perform very well in school.
That's
or
right.
if they've got a toothache, they can't focus on their studies.
That's correct.
So we can address those needs right there at the school site and get them right back to class.
Oh, that is absolutely fabulous. I am so happy to hear that. And I live out by Elsa Weedham School, and I walk every morning, and I see that clinic. I did not know that was, I see the school clinic. I just didn't know that was available to the school community at large.
Right, and the Vallejo community at
The
large.
Vallejo community at large.
Yeah.
Wow.
So, and we provide lots of services. It's staffed by a nurse practitioner on the health side, as well as a medical assistant. So we do immunizations, we do physicals, sports physicals.
Oh, how fast. Do you know how many times I had to leave and go get sports physicals?
I know.
Okay.
I know. Yeah.
Or the immunizations,
Right.
you have
Right,
to.
you have
and
to
now,
have them.
with the state law, I mean,
Right.
that has got to be done.
Absolutely.
And a parent that's working in, I worked in San
Right.
Francisco, okay? So I left at 6 o'clock in the morning. I didn't get back to 6 o'clock in the evening. And it put such a strain on me
it
as a
does.
parent, to have to
Make doctor's appointments.
Make
Right.
doctor's
Right,
appointments.
and find a way to get there.
And find a way to get there, find a way to get my children. I was lucky in that I had lots of family here that, could help me
Right.
out, but
Right.
everybody doesn't have those situations. And so, what an awesome thing. But we should be, how come we're not shouting this from the rooftops? We should be so proud of ourselves for this.
Absolutely.
Yeah.
And that's why we're here again,
That's
just to really let our community know that we're here to serve.
Oh my gracious, this is fantastic. How long has this been going on? I just,
So
it's just
the full service community schools began with the hiring of our new superintendent, Dr. Ramona E. Bishop.
Oh.
And so when she came in, this was one of her visions for our schools. And by the end of 2015, every school site in our district will be a full service community school.
Oh my gracious.
And so we're now in year 2. We began last year with 5 of our schools, 2 of them being our comprehensive high schools, Vallejo High and Jesse Bethel. Solano Middle School, Elsa Weedham Elementary, and Loma Vista are full-service community schools presently. Next year, we're adding 9 more schools, and by the end of 2015, we will be a full-service community school district
Oh my gracious.
with the goal of being able to serve the young people of our city.
That is just fantastic. What a wonderful vision. I mean, we are so blessed to have that in our district. I mean, again, doom and gloom, okay, is what you hear. Teachers are mad, the administrators are mad, everybody's mad, parents are mad, but instead, we have this wonderful program that reaches out to the community. Right. I know when I was chairperson of Vallejo's Juneteenth, that was one of the wonderful facets of that festival, was to make sure that I had community health services out there and dental health services out
Right.
there.
That's
And that was just so important to me. And of course, the medical community just responded beautifully. They, as my sponsors, the two local hospitals here were absolutely fantastic.
You bring up a
Right.
wonderful point when you speak of community partners, because in order to really make this vision flourish, it requires the participation of community members, community organizations, and we're very grateful for some of our long-standing community partners, such as Kaiser Permanente. They have been a partner with the district for many years now,
Many years.
and they consistently support our efforts in being able to produce students that are college and career ready. They run our teen clinic here at Jesse Bethel,
Fantastic.
as well as provided us with pediatricians at our other health clinics to provide services to our students.
I just found out that this is the only teen clinic in the United States that's on campus.
That's run by Kaiser.
That's run by Kaiser.
That's right. That's right.
I-
And actually, our school-based clinics are the only ones in Solano County.
That is
well.
just such a coup. When I think about that, we made the list, Forbes list, they don't know really what this community is all about.
That's right.
You can take some statistics and put it up there and it might look, pretty darn bad, but I was born here, I raised my children
Absolutely.
here, and I love this community.
Absolutely.
And I love this community too. And since I've been here, beginning in 2000, I found the wealth of community partners. And when we initially started working on opening, the idea of opening a school-based health center, there were many community partners in addition to Kaiser that were all about coming on board and how can we help and support. And our community continues to do that.
That
so
is
we are
so
very,
fantastic.
We are very blessed with
That we
the community partners
really,
we
really
have.
are.
I know the Solano Community
Solano Coalition for Better Health.
That's
There
it.
you go, I used to be a member of that.
Solano Coalition of Better Health has also been a partner with us in supporting the health and dental clinic
The dental clinic,
Yes.
yes.
at Elsa Wiedemann Elementary, as well as Touro University.
Oh, definitely.
Yeah.
Oh, wow.
And Toro partners in lots of different ways. They have masters in public health students that come in and teach curriculum to our kids. They have medical students that come in and provide services through our clinics, and it's a training ground for them, as well as
Absolutely.
help for us.
Absolutely.
And Solano Coalition for Better Health has been terrific in really being the lead agency on the dental clinic, which just opened this past year.
No, I'm happy to hear that.
So they're doing wonderful things
Oh, that
through
is
the
just
Wiedemann
so
Clinic.
fantastic. We're talking about the clinics. What are some of the benefits? I mean, we went over them lightly of having a school-based health clinic.
I'll
talk
just
about
tell you,
that.
just from the start, in addition to creating a full-service community school district, the district has goals in increasing student attendance. And one thing we know is that if we can have healthy students and healthy families, then that assists us in maintaining great attendance. Being able to increase student achievement, well, in order for us to do that, we have to have our children in school.
Absolutely.
And so those are two large areas that just having a school-based health clinic on site has really helped our district in maintaining and increasing in attendance as well as student achievement.
In addition, it helps with communicable disease control.
Oh, yes.
So oftentimes, a school secretary or school office staff may see a student that's got a rash or something and think, oh my goodness, I don't know what that is. We need to send them home. Whereas we can see them in the clinic and know that it's not a communicable disease and know that, they're safe and they can stay
And
in
the
school.
kid can actually stay in school.
Right. And it helps us just kind of with the overall surveillance of communicable disease to help, keep our whole community healthy.
I just think this is such a wonderful, I'm so proud and so pleased to know about this, and we're going to be sharing and talking about this information with more members of the community. How are you, else are you outreaching to the community about the news of these full-service community schools?
As this initiative is growing, we have been blessed with having community partners that sit with us at the district level to help move this initiative. Some of our partners include Kaiser, Fighting Back Partnership, Solano Mental Health
Right.
Services.
The county health and social services.
And that is so important. As we all know, a lot of the services have been cut by the state, and et cetera, et cetera. And then, for a young person in crises, where do they go? What do they do?
Right. And that's what we need to find for them, and we need to connect them with the right services so they can be successful.
Some of the services that are, types of services that are available, you talked about the dental health, which is so, so important. I mean, how can a kid sit there and learn anything at all with his tooth hurting? Mom and dad don't have dental health insurance, they're working at minimum wage jobs, or, the benefits, they just can't afford it. And so here's this kid there, and it happens.
It does.
So, the fact that the school district has stepped up to the plate and said, you know what, I'd rather keep this kid in school. Let me partner with some community members and see what we can do about it is just, it's fantastic.
And in addition to that, it's the education piece that goes along with health services. And it's educating the students in being healthy and developing healthy habits like you talked about, and going to the gym and exercising.
Absolutely.
And encouraging our parents and families in the same way goes a long way.
That is just so, so wonderful, because I used to watch people exercise and watch people walk and wonder what the heck was wrong with them, until I got so sick that was the only way that I was going to reverse what was going on with me. And once that light bulb kind of goes off in your head and you see that is the way, I now am so happy with spreading the news, and I'm happy to say that I'm sharing and reaching a lot of folk that have known me for years, and that could look at me and see the difference in how healthy I am and how much better things are for me now that I got up and I stopped watching people, and I actually just got up. I just started walking. I just walked out my front door. That's how it started. I just walked out my front door.
Yeah, that's awesome. I really applaud you for that.
Absolutely.
Because that's a whole change and
it was a complete,
attitude
360 in terms of what it was. I mean, I used to look at people and go, who wants to? I mean, my God, you see them in, come on. And now I'm pushing people. I teach 2 classes, 4 days a week. Twice a week I teach 2 classes, and then the rest of the days it's like 4. I'm a gym rat. I'm just there, and it has made such a difference in my life. And this is where we want to. I was active when I was young, because the school at that time, we had a lot more activities and things. And now, with the cuts and what have you, we don't. So we have to get our children more involved and more responsible and more aware of their own health, what they could do to help themselves.
and start those healthy habits early on.
Very early. It's just like with the Loma Vista Garden out there, the
Right.
farm out there, where they can actually see where food is grown. And
Absolutely.
I mean, Vallejo has so many wonderful things going on about themselves. And this is the opportunity and the time to be able to talk about that and share, the school district's vision. Everybody doesn't make it to those meetings. I mean, they're wonderful, and I've said it, a few of them. And they are great. They're very informative, but everybody can't make it. And so for us to be able to talk about this and outreach and show families that there is some help for them.
Yes.
That's wonderful.
Absolutely.
You talked about some of your community partners already in terms of Touro University and Kaiser, and I'm sure Sutter is a part of that. They were always a part of my festival. I'd knock on the door, and they were always very responsive in terms of I think one year they sent out a nurse, and she took high blood pressure. They did diabetes testing, the whole 9 yards. And so, that's what the community needs. When they're out and they're about, that's when you want to get them. It's nice to be able to say, you go to your private health care primary physician, you go to yours or whatever. But everybody doesn't have that opportunity.
That's
And
right.
so it is up to us as a community to try to help each other
That's right.
be as healthy as we possibly can. So,
And I don't want to miss mentioning La Clinica Dental, because they have been a huge community partner in
Wonderful.
helping to provide these oral health services and dental services.
that
as
is
well.
wonderful. That's wonderful. We certainly don't want to not mention them, because that is a big part. As I said, a kid with a toothache, I mean, he's not going to pay attention. And, now the teacher's got a problem. She wants to label him a discipline problem, but
Right.
kid's got a toothache, okay?
Exactly.
So, and now we can do something about that. We don't have to say, mom and dad, it's all on you, get that kid's, toothache. Now we have the ability to say, go to room 3.
That's
Go
right.
to room 20.
That's right. That's right. And we're also we're always in pursuit of applying for grants.
Oh, absolutely.
In this day and age, we assess our community to continue to stay in touch in regard to what our community is saying. And as the surveys come back and we see more and more about providing support for our students' social and emotional well-being, we wrote a grant last year entitled Project Restore. And we wrote it for 5 of our community, full-service community schools, and won the grant. It's a $1.2 million
fabulous.
grant. And the grant provided us with hiring 2 counselors and 2 social workers to house on our school sites.
Oh my gosh.
So,
How needed is that?
absolutely.
How needed is that? I mean, I'm at the school and you're watching the school climates change, but you don't know what happened to that kid. You don't
That's
know where
right.
that kid had to
Right.
sleep at last
That's right.
night, if that kid got to sleep. You don't know if that kid had anything to eat, and it's nice to be able to say, well, did you have your pencil? Did if he hasn't had breakfast,
right.
what does he care about a pencil?
Right.
What does she care about a pencil?
Right.
They don't care about that. And so we have to just do things differently. And I'm so delighted to know that our school district is responsive and moving in that direction and asking the community.
Yes.
That's real
Right.
important.
And the students as well.
And the students, what do you need? What
That's
do you
right.
want?
That's right.
What's gonna?
How can we make it better?
How can we make it better for you? Because we all need to grow and learn from one another. How can we make this better for you?
Right.
Absolutely. Well, we're very appreciative of the leadership that we've been given in the role of our superintendent, Dr. Bishop, as well as the governing board. And
That's fantastic.
absolutely.
Yeah, she's a absolutely fantastic lady. I've had the opportunity to meet her. I wanted to interview her. I'm going to get her. She's eventually, she's so busy, but eventually I intend to get her, and we're going to talk even more about the vision that she has and that she has set forth. I think that is just fantastic. As I said, I was born here. I've watched a lot of things, and to see things grow and to see things move and, to see the progress that we're making, although what you hear is doom and gloom. But there's progress.
Absolutely.
It may not seem like a lot of progress, but it's progress. This is fantastic. I can't talk enough about it. Do you outreach at all this information out to the local churches and nonprofit organizations that are out here?
So through each of our school sites have pamphlets and flyers that are distributed out on each school site, as well as information can be taken from our website.
That's lovely, and I love websites, and folks love websites, but not everybody has a computer, and so that's the other thing, and so we just have to learn how to be more responsive to those of us that are still, I'll just call us baby boomers, and just leave it like that. And some of us, we get along pretty well with it, with the social media, the Twitters and the Facebooks and the other stuff, and then some of us go, huh? Okay, so we want to take this opportunity to talk about these health clinics, to let the community know that they are available.
Right.
We want to really reach out to them, and so as I continue to talk about and the different things that go on in the community, I'm going to try to keep this as a little reminder to folks
Yes.
about these health clinics that are going to that are at these particular school sites, and let folks know that it is not only available to the school district, but to the general
City.
City.
That is just almost unheard of. And we have that.
We
We
do,
have it.
right
We
here in
have
Vallejo.
that.
Have more than one.
Right here in Vallejo.
Yes.
You know, I call it the old name, Vallejo, Valley Joe. That's when, you've been here for a long time, right? Oh my gosh, I am so delighted. I'm going to spread the news. I'm going to share, talk to some of the churches, maybe pass some flyers out, and let them know that this is available, because they need to let their members know.
Absolutely, absolutely.
You know?
We have a
And
wonderful.
we have flyers that we can
That is
disperse.
where I will be in touch with you all, and maybe like the Boys and Girls Clubs. I mean, do they avail themselves of that?
They
do they
do.
know about
Yeah,
that?
they do. We do partner with the
You
boys,
do partner
the
with
Mega
them.
Boys and Girls.
Yeah, I had a fun time building that park with them out there. I wrote that grant along with the help of some other people at the Boys and Girls Club, and September the 27th, 2007, we did that
Wow,
one-day
that's
build of that.
wonderful.
Oh my God, was that fun? Oh, that was
I
fun.
bet. I
It's
bet.
an $80,000 grant, $85,000 grant, and Vallejo had already received one grant from Kaboom. But I don't take no for an answer. Anybody that knows me knows I don't take no for an answer, and so I just kept knocking at the door. It took 3 years, but we got another one. So
That's what it takes
That's-
sometimes.
that's
It's
definitely what it
persistence.
takes.
yeah, that squeaky wheel, that
That's
one that
right.
says, oh, she won't go away. She just keeps coming back.
Give her
you
what
know?
she wants.
Give her
That's
what
right.
she wants, because she will not go away. I told somebody that at the city planning department. I did. I said, you might as well give it to me.
Yeah. And that's what it took for our health clinics. It took many years of pushing the envelope and letting the community know about it.
You might
because
as well give
takes-
it to me.
Yeah.
I'm gonna keep
Yeah,
coming.
we kept
I'm
on
gonna
going.
keep coming. I'm not gonna stop. I'm just gonna keep coming.
Right, right.
Well, you ladies were absolutely fantastic. You were wonderful. I thank you so much for coming on my show and
Thank you for the
spreading
opportunity.
this good news. Oh my gracious, it's wonderful.
Well, we greatly appreciate the opportunity
Absolutely.
to share the word.
Well,
Yeah.
any last minute wrap ups?
Just again, thank you again for this opportunity, and I think we should give a shout out to our wonderful health and dental clinic staffs that work in the 3 clinics. They're doing a wonderful job,
They
and
are.
again, we're here to support the city of Vallejo.
That is so fantastic. Matter of fact, I'm going to give that dental health a hand, because I think that is wonderful. All you do is you think about kids and their needs and how we can help and support them in their needs. Everybody wins.
That's right.
It's a
That's
win-win
right.
situation for absolutely everybody. And so, having said that, I thank you both again for being my guests and for sharing this good news with the entire community of Vallejo. I don't know how many people watch. I know my mom watches, for
All right.
sure.
Hi, Mom.
Okay. Hi, Mom. But the rest of the community, I know, is going to be delighted to find out this information. This is very, very wonderful. This is a coup in Vallejo's cap.
That is.
Okay? And I thank you again for coming. Now, I want to close out this show with thanking Ms. Shackelford and Ms. Hahn again for being my guests, but also to let you know that these health clinics are available for you. You need to reach out. Any information that you need to have, you can contact the Vallejo Unified School District. Now, I'm going to have Alana give us a number and a website.
Feel free to contact us at 707-556-8921.
Thank you. And you can, again, use the Vallejo Unified School District's website and access this information. Vallejo, we are very, very lucky. We have something that no one else in the United States has, okay? So let's avail ourselves of it. Let's spread the news, and let's keep it together for our children, the citizens and the community of Vallejo and surrounding areas. Thank you very much. My name is Deborah Dixon. I appreciate you watching the show, and I'd love to have you come back again and hear some more good news about Vallejo. Thank you.